Welcome to the deep dive. Today, we're heading out to a place I bet most people only dream of visiting.
Taking a vacation.
Yeah, in a way. We're going to Lakshadweep. It's a group of 36 islands off the coast of India. You know, beautiful beaches, swaying palm trees, that kind of thing.
Sounds amazing.
Yeah.
And I have a feeling we're not just here to soak up the sun.
You know me too well. You've provided us with some pretty in-depth research on Lakshadweep's healthcare system, and it's pretty fascinating stuff.
Yeah, it's definitely unique. A real mix of, government initiatives,
Yeah.
unique challenges, and a lot of potential for some interesting innovation.
Exactly. We're going to uncover how this remote location really impacts healthcare. Everything from the role of the government.
Yeah, and governance role is huge there.
Huge.
Yeah.
To the fact that there are no private hospitals.
Wow, so it's all public.
Yep, completely public. Get ready for stories about helicopter evacuations, telemedicine across the ocean, and...
Wait, hold on. Helicopter evacuations.
Oh, yeah, you'll hear all about it. Oh, and the crazy impact of the monsoon season on even getting basic medical supplies to the islands.
I'm already hooked. And you know what else is interesting? It's not just about Lakshadweep itself. This situation offers some really valuable lessons on how geography and resources and technology all kind of come together to shape healthcare access.
That's such a good point.
And these are insights that are relevant to so many remote communities all around the world. It's a much bigger story than it might seem at first.
Okay, so first things first. Let's paint a picture of this place. Lakshadweep. We're talking 36 islands scattered across the Lakshadweep Sea. Just geographically speaking, that's got to create some serious challenges for healthcare, right?
Absolutely. I mean, just getting around is a huge obstacle, right?
Yep.
Picture trying to get a patient from one island to another for specialized care.
Or transporting important medical supplies.
Exactly. Or even convincing doctors to move there in the first place. It's not exactly an easy sell.
It's a tough one. So that's where the Indian government really steps in, right?
It's that time.
They're essentially running the entire healthcare show in Lakshadweep.
That's right. The Directorate of Health Services, which is a part of the central government, they're responsible for pretty much everything. Funding, staffing, you name it. It's a very hands-on approach.
So what does this actually look like, on the ground? Can you kind of paint a picture for us? What kind of healthcare infrastructure are we talking about?
Okay, so picture this. A network of, small clinics scattered across these really idyllic islands. On each of the inhabited islands, you have what they call a primary health center, or a PHC.
A PHC, okay.
And these PHCs offer basic care. So, emergencies, maternal and child health, that kind of thing. Really, they're the first line of defense for these communities.
I see, kind of like the local heroes of healthcare.
Totally. I think you've got a couple of community health centers, or CHCs, on the islands of Minicoy and Agatti, and they provide a higher level of care. And then sprinkled throughout, you have even smaller clinics and dispensaries reaching those really remote areas.
It actually sounds pretty comprehensive for such a remote location. But I'm guessing that doesn't mean everything is easily accessible, right?
You're right about that. One of the biggest challenges is the lack of specialists. The research shows there's only one cardiologist for the entire island chain.
Whoa.
So if you've got a serious heart condition, you're looking at a trip to the mainland for treatment.
Wow, that really puts things into perspective. So even with these local clinics, getting specialized care is a whole other story.
Absolutely. And that brings us to the fascinating world of emergency medical evacuation services.
Oh, yeah. You mentioned this earlier.
For really critical cases, especially during monsoon season when the seas are rough, they actually airlift patients by helicopter or transport them by ship to Kochi.
Wow, that's intense. I mean, helicopter evacuations, that sounds like a logistical nightmare to coordinate.
It is. And the government takes on most of that responsibility. They organize getting the patients to the mainland. They even cover the travel and treatment costs for those who can't afford it.
It sounds like they're going above and beyond to try to bridge the gap created by these geographical challenges. But what about everyday healthcare? What kind of support do people have beyond these emergencies?
Well, everyone in Lakshadweep gets free healthcare through various government programs. Plus, they've implemented Ayushman Bharat, which provides a health insurance coverage of 5 lakh.
That's significant. But I can't help but think about those logistical hurdles again. How do people even reach these healthcare facilities on different islands? Is it mainly by boat?
Yeah, boats are definitely part of the equation, but the government is really pushing digital health and telemedicine to kind of connect those islands with specialists on the mainland. They've even introduced a platform called eSanjeevani for virtual consultations.
Oh, wow. So they're really using technology to try and shrink those geographical distances, bringing healthcare closer to people.
Exactly. It's a way to get specialized expertise to the islands without physically moving the specialists. And on top of these kind of high-tech solutions, there's a big focus on preventative care and community health, too.
What does that look like in practice?
Well, they have these regular health camps for things like screenings and vaccinations. They've got programs trying to prevent lifestyle diseases like diabetes. And they've got others to control diseases like malaria and dengue fever, which are obviously a concern on the islands.
Yeah, that makes sense.
That's all about being proactive and reaching people where they are, taking health care to them.
It sounds like they're trying to cover all the bases, but I have to ask, despite all these efforts, there have to be some serious downsides to healthcare in such a remote location, right? What are we missing here?
You're absolutely right. The challenges go beyond just getting to a clinic.
Right.
A major one is the shortage of healthcare professionals, especially specialists. We touched on it earlier, but it's worth emphasizing because it's a constant struggle.
Yeah, I mean, it's one thing to have the facilities, but you need qualified doctors and nurses to staff them.
Oh, exactly. Lakshadweep has real trouble attracting and retaining qualified medical professionals. Many of them end up serving on short-term contracts, which means care isn't always consistent. You have doctors coming and going all the time.
Yeah, I imagine it's a tough sell to convince someone to relocate to a remote island with limited resources, especially when they could have more opportunities elsewhere.
Right, and that brings us to another challenge. Lakshadweep relies entirely on the government for health care. There are no private hospitals or clinics, so people depend solely on those government-run facilities. And they can be overstretched and may lack some of the advanced equipment that you might find in a bigger city.
So you're at the mercy of the government's resources and priorities. That's a lot of pressure on one system.
It is. And it raises a lot of questions about how healthcare could be delivered differently in Lakshadweep. Maybe there are some alternative models they could explore.
So we've got this picture of a healthcare system grappling with isolation, limited resources, and total reliance on the government. What does this actually mean for the people living in Lakshadweep? What's their experience?
Well, imagine you need specialized care for something serious. You're probably facing a trip to the mainland, which can be costly, time-consuming, and emotionally draining.
And if the weather's bad, you might be stuck waiting, adding even more stress to an already difficult situation.
Exactly. And even for routine care, the lack of specialists and advanced equipment is a limitation. You might have to travel all the way to Kochi for a routine CT scan, for example. It's a big commitment.
Yeah, it makes you realize how much we take for granted in terms of healthcare access.
It really does. Lakshadweep shows how much your location can impact your health outcomes.
So now that we kind of understand the challenges, what about potential solutions? What can be done to try to improve the situation?
Ooh, that's where things get really interesting. There are a lot of potential solutions, and some of them involve thinking outside the traditional healthcare box.
I like where this is going. Give us the rundown.
Okay, so one idea is bringing private healthcare providers into the picture. Right now, it's all government-run, but introducing private hospitals, clinics, even telemedicine providers could make a huge difference in access to care.
So diversify the system, bring in more players to share the load.
Precisely. And it doesn't have to be one or the other. Public-private partnerships could be a game changer. Imagine private hospitals in Kochi setting up outreach centers in Lakshadweep or working with the government to organize visits from specialists.
That sounds like it would be beneficial for everyone involved. The private providers could expand their reach, and the islanders would get specialized care without having to leave.
Exactly. And then there's the whole world of technology. We talked about telemedicine, but think about the potential of AI-driven diagnostics and portable health tech. Those could completely change healthcare in remote places like Lakshadweep.
Wow, I can see it now. Portable ultrasound machines, AI analyzing symptoms. It's like bringing the hospital to the patient.
You got it. And these technologies are getting more affordable and accessible every day, opening up tons of possibilities for remote healthcare.
This is giving me a lot of hope. It sounds like there are viable solutions. It's just a matter of putting them into action. What's the situation on the ground? Is any of this stuff actually happening?
Well, people are definitely starting to recognize the urgency of the situation. The government is actively looking for ways to improve healthcare in Lakshadweep, and they're open to new models of care. They're realizing that the old ways might not be enough anymore.
So it sounds like Lakshadweep is at a bit of a turning point. There are huge challenges, but also the potential for some really transformative solutions.
I think you've summed it up perfectly. Before the break, we were talking about technology, and it got me thinking, is Lakshadweep almost like a testing ground for the future of healthcare, especially in these isolated places you know?
That's a really interesting way to look at it. It's like a mini version of all the challenges and opportunities healthcare systems are facing all over the world, especially in areas that are, underserved. What's happening in Lakshadweep could actually be a lesson for so many other communities that are dealing with similar obstacles.
Right,
Yeah.
exactly. It's a unique microcosm. And speaking of unique, let's talk AI for a minute. I can totally picture this. Someone on a remote island, they start to feel sick, right? They pull out their phone, they tell an AI-powered app what their symptoms are, and they get like a preliminary diagnosis or advice on what to do next.
It's almost like having a pocket-sized doctor.
In a way, yeah. But it's important to remember that AI is a tool. It's there to help doctors and nurses, not to replace them entirely. The best case scenario is when they can work together, you know?
So it's more about teamwork than replacement.
Absolutely. AI can help healthcare providers in Lakshadweep see more patients, make faster diagnoses, and offer more personalized care. It's about multiplying their impact, making them even more effective.
I like that. So AI is a big one. What other cool technologies could really make a difference in a place like Lakshadweep?
Well, telemedicine is already changing things, but there's always room for improvement. Imagine high-definition video calls that let specialists in Kochi actually examine patients in Lakshadweep, almost like they're in the same room.
Wow, that would be incredible. No more risky boat trips or expensive helicopter rides just for a checkup.
Exactly. And we're also seeing these amazing new portable devices like handheld ultrasounds, blood analyzers, even things that can track your vital signs remotely. Healthcare workers on the islands could provide more thorough care without needing bulky equipment or labs.
So it's like bringing the lab to the patient instead of the other way around.
You got it. And don't forget about drones. They have the potential to completely change how we transport medical supplies, even blood samples between the islands.
Wait, drones delivering medicine? That sounds like something straight out of a sci-fi movie.
It's closer to reality than you might think. There are already pilot programs using drones for medical deliveries in lots of parts of the world, especially in remote locations. It's a game changer.
This is all super exciting, but we have to be realistic too, right? Technology is amazing, but it's not a cure-all. Lakshadweep still needs better infrastructure, more trained healthcare workers, and consistent investment to make all this stuff work. It can't just be about the gadgets.
Oh, you're absolutely right. Technology can boost and improve what's already there, but it can't create something from nothing. The human element is still essential.
So how do we tackle those other challenges? How do you attract doctors and nurses to want to work in a place as remote as Lakshadweep? I mean, it's not exactly easy to get people to move to a tiny island in the middle of the ocean.
That's the million-dollar question, and there's no easy answer. But a few things could definitely help. Offering competitive salaries, housing allowances, even loan forgiveness programs could make Lakshadweep a more attractive place to work.
So it's about making it worth their while, both professionally and personally.
Right. But money isn't everything. You also need a supportive work environment, Things like opportunities for professional development, a strong sense of community among the healthcare workers, and making sure their families have access to good schools and amenities. All of that can make a big difference.
It's about a whole package that addresses their needs as people, not just as employees.
Exactly. And we can't forget about investing in education and training within Lakshadweep itself. Encouraging young people there to pursue healthcare careers could create a pipeline of local talent, people who are already connected to the community and invested in its well-being.
It's like building capacity from within. It's a long-term solution, but it's a crucial one, for sure.
Definitely. What strikes me is that Lakshadweep's healthcare challenges aren't actually that unique. We see very similar issues in rural communities, indigenous populations, even some urban areas that are underserved. The challenges are just amplified in a place like this.
That's so true. So in a way, what's happening in Lakshadweep could be a model for other places that are struggling with healthcare access. What works there could work in other challenging environments too.
Absolutely. It's all about finding creative solutions that use technology to the fullest, empower local communities, and bring the public and private sectors together. It's a collaborative effort for sure.
Lakshadweep is almost like a blueprint for the future of healthcare in these challenging environments. It's a fascinating case study.
I'd say it's more like a living laboratory. We can test new models of care, try out cutting-edge technologies and learn from what works and what doesn't, and then we can share those lessons with the rest of the world. The possibilities are exciting.
This is giving me a lot of hope. It's a reminder that even when the challenges seem huge, there's always room for progress and innovation. There's always a way forward.
That's what makes this deep dive so interesting, right? It's not just about understanding healthcare on one group of islands. It's about exploring the possibilities of a healthier and more equitable future for everyone.
Well said. I think we've covered a lot of ground here. But before we wrap up, I want to circle back to something we touched on earlier, the government's role in all of this.
Yes. The government is a key player in Lakshadweep, just like in any healthcare system, really. They set the tone and direction.
Right. But in Lakshadweep, it's even more pronounced because they are the only provider of healthcare services. So what does that mean looking ahead?
What it means they have a huge responsibility to make sure healthcare services are accessible, affordable, and high quality for all the islanders. They're the ones calling the shots, so they have to make sure things are working well.
Talk about pressure.
It is a lot of pressure.
Yeah.
But it also gives them a really unique opportunity to shape the future of healthcare in Lakshadweep. By embracing innovation, investing in infrastructure, and working collaboratively, they could create a healthcare system that truly serves the needs of this unique community.
It's a chance to create something really special, something other regions facing similar challenges can look up to and learn from. They could be a real pioneer.
Exactly. And that's why it's so important to pay attention to what's happening in Lakshadweep. It's a story that's still being written, and it could teach us all some really valuable lessons about the future of healthcare. It's a microcosm, but it holds some big lessons.
It is a fascinating story. And on that note, we'll be back after a short break to discuss the potential downsides and ethical considerations of using these advanced technologies in a place like Lakshadweep. Stay with us. Okay, so we're back, and we've really been on this journey exploring healthcare in Lakshadweep, where geography meets innovation and technology has such huge potential. It's been a really interesting deep dive.
Yeah, it has. From those intense helicopter evacuations to AI and everything in between, we've covered a lot of ground.
We have. But before we wrap things up, I want to talk about something that's been a kind of a recurring theme throughout this deep dive. The government's role in all of this. They're the sole healthcare provider in Lakshadweep, so their decisions have a massive impact on people's lives.
Yeah, no doubt about it.
So as we look ahead, what do you think their priorities should be? What should they be focusing on to really make a difference in people's health outcomes?
That's a great question. I mean, the government has this huge responsibility to make sure that everyone on those islands has access to healthcare that's affordable, high quality, and meets their needs. It's a big job.
It's a big job. It's a lot of pressure on them. But it's also a huge opportunity, right?
Yeah, absolutely. They're in a position to really shape the future of healthcare in Lakshadweep. If they embrace innovation and invest in infrastructure and really promote collaboration, I think they could create a healthcare system that's truly a model for the world.
It's interesting because a lot of the challenges that Lakshadweep is facing are challenges that we see in other parts of the world too. Rural communities, indigenous populations, even some urban areas that are underserved. So what they're doing there could have implications far beyond those islands.
Exactly. That's why it's so fascinating to me. It's like a microcosm of global healthcare challenges and opportunities.
Yeah.
What works there could work in so many other places.
Well, this has been a truly eye-opening deep dive into Lakshadweep's healthcare system. I think we've all learned a lot about the unique challenges and opportunities of providing care in such a remote and beautiful part of the world.
It really highlights how interconnected everything is. Geography, resources, technology, and the human element all playing a crucial role.
It's a reminder that healthcare is not just about hospitals and doctors. It's about access equity and finding creative solutions to serve the needs of diverse communities no matter where they are.
Well said. And you know what else it reminds us of? The power of innovation and collaboration. We've seen how Lakshadweep is embracing new technologies and approaches to healthcare, and that gives me hope for the future.
It gives me hope, too. And it's a reminder that even in the face of huge challenges, there's always room for progress and improvement. So as we wrap up this deep dive, I encourage everyone listening to keep learning, keep asking questions, and keep pushing for better healthcare for all.
That's the spirit. Thanks for joining us on this incredible journey to Lakshadweep. It's been a pleasure exploring these complex issues with you.
Thanks for being here. And to all our listeners out there, stay curious, stay engaged, and let's keep working together to build a healthier and more equitable future for everyone.